We also know that's multifactorial, but historically, weight loss medications have really targeted appetite through central neurotransmitters, often at the expense of cardiovascular safety and long term tolerability. So, you talked about phentermine. We knew that that revved up your heart rate and really was not a long term sustainable solution. So, GLP-1 receptor agonists really are the first class of medications, and they are fundamentally different because they work with human physiology rather than overriding it. So, GLP-1 medications and GIP medications, which I know we're going to talk about a little bit more, are incretin hormones. These are released from your gut, your GI tract, in response to food intake, and they act on the pancreas to enhance your glucose dependent insulin secretion. So, they stimulate your body to put out insulin, they suppress glucagon, they preserve the function of your pancreas and your beta cells. And so, but what's really transformative for these is that these receptors are expressed all throughout the body, not just in the gut, also in the brain, the kidneys, your fatty tissues. And so clinically, this all translates to a slowed gastric emptying. So I always talk about it slows down your GI tract, makes you feel fuller, faster. So it enhances satiety, is what we say. And that's through signaling that's done in your brain at the hypothalamus. It reduces food noise, improves insulin sensitivity, and has a lot of favorable cardiometabolic effects that we are finding out about without that stimulant burden of some of the older agents. But clinically, when I talk a patient through this, why would I choose semaglutide over tirzepatide? One factor is budget. I'm not going to lie to you. Semaglutide tends to be more affordable than tirzepatide. One is weight loss goals. If I have a patient who needs to lose 15 to 20% of their body weight, I'm going to select tirzepatide. If I have a patient who has a busy lifestyle, they work in an operating room, they travel all the time for work, they can't be sick all the time, I'm going to choose tirzepatide because side effects are much lower with that medication than they are with semaglutide. And so many patients experience greater weight loss and tolerability with that tirzepatide or the dual receptor agonist.